Welcome to Lesson 4 of the Fetal Biometry course. In this lesson we will focus on the key fetal biometry measurements used in the third trimester to assess fetal growth and development. In the third trimester, accurate fetal biometry is essential for monitoring fetal growth and detecting abnormalities such as intrauterine growth restriction or macrosomia. Unlike earlier pregnancy stages, the third trimester focuses on assessing how the fetus is growing, providing valuable information for clinical decision-making and patient care. We'll explore essential parameters like biparietal diameter, head circumference, abdominal circumference, and femur length, which are crucial for determining fetal well-being in the final stages of pregnancy. Let's begin with the biparietal diameter, or BPD. As we mentioned in previous lessons, to measure BPD, we use a transverse plane through the fetal head, ensuring that the calipers are placed between the outer edges of the parietal bones. BPD helps us assess the size of the fetal head, and normal values vary based on gestational age. A significantly smaller or larger BPD may suggest issues such as microcephaly or macrocephaly respectively. Next, we move on to the head circumference, or HC. HC is measured around the outer perimeter of the fetal skull at the level of the BPD. Like BPD, HC is an important indicator of fetal growth. Abnormal HC measurements can indicate a range of conditions, from conditions affecting brain development to overall fetal growth restrictions. It's especially useful in conjunction with other measurements to assess overall fetal development. The abdominal